At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome. Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live right here on WMAL 105.9. Got a program for you today, one that so many of you have. When you hear the term that I'm going to talk about, you think, oh my God, I'm stuck with it forever. But life is over. I'll never be able to do what I want to do again. And you know, it goes into this, well, it must be my age, or, you know, whatever happened to me is not reversible. What am I talking about? I'm talking about something called spinal stenosis. And that's a degenerative change that takes place in the low back. When I get into the live stream today, I'm going to show you what spinal stenosis looks like. So make sure you join me. Go to drtomroselle.com. But if you're following me on your social media sites, we're going to let you know immediately that it's available and you can check it out. And remember that all past programs, both the radio program and also the live stream programs, are available on drtomroselle.com. So join us there. But let's get into the program because it's an important one that we're going to cover today. It's really serious because it affects way, way, way too many people. Spinal stenosis, my dear friends, is characterized by the narrowing of the canal, meaning the hole where the nerve comes out. And that hole is made by two bones, two vertebrae sitting on top of each other. And the way that they link together allows a big opening for the nerve off the spinal cord. You have 31 pairs of them throughout your body that exit. Now, on the 16th of this coming month of July, Dr. Harlan Browning and I are going to do a presentation on Oh My Aching Back, but we're going to cover this piece as well, spinal stenotic patterns, but we're going to teach you how to get out of the mess, this low back pain that debilitates so many people, stops you from enjoying your life, can't pick up your kids or your grandchildren, you can't go out and play a game of pickleball or go for a long walk without it's killing you, your legs are aching, you got that tingling, that spinal stenosis, that numbness, that weakness. Well, we want you to be able to enjoy life. And there's ways of getting that done. You're going to hear me talk a little bit more as we get into the causative patterns, you know, particularly into the live stream of lifestyle that causes these things to get worse. Now, so what happens? Let me tell you what happens when you go to traditional, physicians, because they don't look at the structural, chemical, emotional platform. They look at what you got and what they can do about it. In most cases, nothing completely. Depomedrol, it's an injection, as we just said, into the spine. They do two of them. The side effects can be quite significant. It reduces inflammation, and that's how it works because it's a steroid substance. And, the interactions are continual to build on each other. If you've had three of them, doc said, I can't do any more than that. They do one every 2 weeks. It can even affect your eyes, blurred vision. You can have eye pain with it. You can see halos. It can cause your breath to feel like it's labored, swelling. You can put on weight because it's a steroid. You can go into depression, personality shifts. Your personality shifts and your back pain all the time. Your personality is not happy. You can have upper stomach pain. You can have back pain, nausea, vomiting, and even cause you some bleeding. Now, the list is actually much longer than that, but I want you to get the idea that, these things are not without their side effects, their consequences, and you don't need to have that if you know what you need to do as because of it, right? So spinal stenosis is a narrowing in the canal that your nerve root comes out of, your spinal nerve roots. That stenosis that you have. You're going to hear me talk a little bit about how it affects genitalia. Guys, some of that erectile dysfunction that you have, positionally particularly, and that has to do with your back. It's not necessarily hormonal. And so if that's the case, when you have symptoms that worsen when you stand up or symptoms that worsen when you walk around, and it's not your hips, but it's the direct sciatica or femoral pain or things, numbness or tingling and so forth, that says that you got something going on there. But the problem is that a stenotic pattern, spinal stenosis, is something that is progressive unless you stop it. And by the way, if you stop it, can you reverse it? And I'm here to tell you, after treating thousands and thousands of patients over my career, that if you become a partner in your own health, you can reverse this. So join us on the 16th, July, 6 p.m. at the Roselle Center for Healing. And Dr. Harlan Browning and I will get into this in a deep, deep dive and show you what you can do. There's exercises that you can do. There's foods that will make things much worse or foods that will make things much better. I'm going to take away some of that carnivore diet from you right now. If you have spinal stenosis and you're eating meat all the time, you're about to make it worse. It's one of the worst things that you can do for spinal stenotic patterns because it will trigger gout reactions, and those crystals can get in there and cause damage, degeneration, and so forth. So if that's the case, maybe we need to eat softer proteins, meaning things that aren't capable of doing those things. So eggs and chicken and wild fish and fatty fishes, a lot of good oils, olive oil, and so forth. So understand that there are things that you can do to make a big difference in your life. But are you willing to shift? Are you willing to get off the drugs? What are they going to do? They're going to put you on anti-inflammatories. They're going to put you on oxycodone and gabapentin. They're going to put you on other pain type of medications. They're going to limit your lifestyle. They're going to tell you can't do this, you can't do that, be careful of this. And, but if you have a dietary pattern that causes inflammatory reactions within your system, you're set up for problems. And, there's very specific foods that we all know about. We just don't want to deal with them, right? We talked about the steak, the hamburgers, the bacon, the sausage, the hot dogs. I just took away most of your diet, deli meats particularly. So chronic link, besides spinal stenosis, to your heart, kind of linked to your other joint spaces. How about diabetic processes, that peripheral neuropathy? Now you know how it comes about. The nerve gets crushed, the inflammation gets high, and you have this numbness and you can't feel anything and so forth and so on. It's a lousy process, but you have to go to a anti-inflammatory diet. You got to make sure you get enough grams of protein per day. How many do you need? If you're on the starvation side, and I say that lovingly, you need to get something in the neighborhood of about 55 to 60 grams of protein. But the truth of it is, you take your body weight and you go about 0.5, and whatever that number is the amount of protein in grams that you should be trying to get in your system on a day-to-day basis. So we want to eliminate the refined carbohydrates, particularly the white breads, the cereals, the pastas, the rice. I know I'm not being nice to anybody today, and I'm taking away all the things that, that American diet is all about, right? Well, why? Because it's addictive. How about the margarines? How about the non-dairy creamers? And the only creamer you should use if it's organic, and then have just a little bit, a drop or two of it. But snacks, chips, cookies, the flavored yogurts, the refrigerated dough and biscuits and so forth. I know I just wiped out everything out of your cabinet. But listen, is it worth saying, well, maybe I'm doing things that I shouldn't be doing. Maybe, I need to do something differently. We have to get very high levels of omega-3 fatty acids in our body and balance them with omega-6s. The omega-9s, nope. If there's any trans fats, nope. We have to get what we have that will support our bodies. So understand, this is a real deal situation. I don't want anybody to suffer. I don't want you to have a bad life. I want you to enjoy your life. I'm trying to figure out how to put another, 3-4 decades onto it. Why don't you join me and we'll figure it out together. But we're going to do a lot of that on the 16th. I'm going to show you what's possible, what you can get done. But if you're going to go, well, I'll just let my doc inject it and see how I feel. Well, I'll as long as I take this medication, it's not that bad. But you're giving up what? You're giving up going for a walk. You're giving up playing catch with your kids, your grandchildren. You're giving up, getting to the gym and doing something light, doing some stretching. You're stuck in front of the television with a remote. You don't want to do anything because you don't have any energy to do it because you're in pain all the time. That's everything that goes along with spinal stenotic patterns. I don't know about you, but it's something that can be done. I want to do it. If there's something that can give me my life back where I have clear head and no pain and the capacity to move and do what I want to do, yeah, I want to do it. But if we're stuck with an injury that is not corrected, and we have a dietary pattern that is awful on top of that injury, and then we go into stinking thinking and negative mindset, I promise you, you're going to go down the tube very, very rapidly. But spinal stenosis is nothing to ignore. It's not something that you have to wait till the doc says, well, we're going to go do surgery. And we're going to put spacers in between the bones, and that will give you some relief. Well, there's two things that they forget to tell you. When they suggest surgery, number one, the surgery is not necessarily going to be successful. And those that have some pain elimination, and by the way, what do we mean successful? That we means that it doesn't get worse, and maybe you get a little bit better, and that's 50% of the cases. Now, what's the next step? Well, the next step is that over a period of 7 years, that the majority of cases that were successful are now failures. So it's going to give you a little bit of a window, but not a long period of window. It's not permanent. So if there was something else that you could do to reverse the spinal stenosis, this narrowing that occurs because of injury and scar tissue and calcification in the spinal canal, are you willing to do something to get your life back? The point of it is, I wouldn't be saying this to you if it wasn't something that you could do and take control of. We get patients that come in and we see vertebrae, bones in the spine that are misaligned, and we find the muscle inhibition, weakness. We find areas of loss of sensation. We find that they can't stand up on their toes. We find that it's difficult for them to go upstairs. And I show them exactly where it's coming from. I can prove it to them. I test a thigh muscle, your big muscle in front, have them sit, push down on it, it weakens. Then I put a block behind their low back. And lo and behold, what happens is the muscle gets strong. It facilitates better. And they look at me and say, what did you do? I said, nothing. I just moved your vertebrae in a more supportive position. I said, that can be done and fixed and resolved. But then when I tell them that they have to do some biochemical changes, I didn't tell them what it was yet. You see their eyes go, I'm not doing that. Or, you have to get treatment to be able to move the vertebrae in a normal position, very much like you put dental braces on. It's going to take some time. I said, well, I don't have the time for that. Well, do you have the time to allow your body to get progressively worse and degeneration to magnify itself and progress down the wire until you can't do anything? Well, join me on the 16th. And at least get the data, the information, so you understand the choices that you have in front of you. So spinal stenosis can be helped by you. Don't put ice on your low back. Put warm, moist heat on your low back when it feels like it's locking up, and only for a short period of time. Don't use a heating pad. Moist heat on your low back. Most of you don't drink enough water, and so it enhances and perpetuates that degenerative disease. Why? Because the low back, the disc spaces, those little shock absorbers, are 75% water. So if you're dehydrated, those guys are going to shrink up and they're going to go into degeneration, called what? Spinal stenosis, ultimately. And you're going to have that discomfort walking, and it's going to be hard to stand in one position. You see, be tottering back and forth, and it hurts. You can't feel your feet anymore. That is spinal stenotic pain. Now, there's a lot that you can do about it. And if you're sitting here and said, yeah, I've had all this for a long period of time, well, maybe now, when would now be a really good time to change your mind about what it is that you've been doing for a period of time. Unless you like pain, unless you like being stuck on every drug known to mankind, and now all of the anti-inflammatory drugs that are coming out, they're all designed after these, they're called biologics. They suppress the body's immunological reaction, so it's not protecting you from anything anymore, and your body starts having other problems on top of that. But foods are important. We touched upon that just a little bit. There's a lot of them out there that cause inflammatory reactions, and you have to understand that it's well known, but people don't want to take the time to give up their French fries, give up their processed meats, to give up their deli products and so forth. Get rid of the substitutions for the oils and so forth. Get real oil in your body. Oil is good for you. It's not bad for you. It's good things for you. Get those proteins up so you can heal. Make sure you're drinking a lot of water. Get a little stretching done and walk. Years ago, and you've heard me say this before, exercise, people who walk 2 miles a day, I don't care how fast you walk, you can go slow-mo. 2 miles a day have a 50% chance of decrease in dying from any kind of disease process. Isn't that cool? That includes developing spinal stenotic patterns. If you watch what you eat and you get out and walk, you stretch just a little bit, just doing that will make a huge difference in how your body functions. I don't know about you, but that's kind of my repertoire on a day-to-day basis. I get up and the boss and I, our creator, have a conversation, and then I do a little meditation. Then I get on the floor and I do a little stretching. Then I go for a walk. Then I may add a little bit of heavier exercise depending on the day, but every day I start that way. So I'm at that place where I'm older than most people now. So if I can do that on an ongoing basis, why can't you? Is my motivation more than yours? And it's not because that we're without pain. I did all the crazy things throughout the years. Played Division I ball in college, and went to boot camp, and martial arts in my 40s. Jumped out of perfectly good airplanes, all kinds of different things, and the list goes on. Accidents, we won't even count those. So this old body of mine's been beat up in a lot of different ways, but I keep finding ways to be able to function at very high levels. Don't you want to do that? Don't you want to make a difference in your life? I would encourage you. I would totally motivate you in any way that I possibly can to change, not to get stuck. Don't have your doctor say you have spinal stenosis and it's just the way it is. And if we do surgery on you, you may get some relief. But, what's the but? It could get worse. You could end up. There was a woman whose doctor told her that she needed surgery to get rid of the neck, arm, and shoulder and hand pain. It was the only way that it was going because she had spinal stenosis. And she goes into the surgery and she comes out quadriplegic. Now, am I saying that to scare you? No, I'm just saying that to get your attention, to let you know that there are things that can take place. It's not a one and done, or at the worst case scenario, there's no problem with it. It's just, you were where you're at before. You're going to give up certain things. But if you knew you could resolve something by changing what you do, by changing how you focus on something, and get even 50% of your life back, would that be something that you want to know more about? I don't know about you, but my brain says, yeah. So join Dr. Harlan Browning and myself. Dr. Browning, the professor, which many of you know is brilliant. We're going to give you a couple options. We're going to show you different things. But more importantly, we're going to let you know the truth. And we're going to send you home with things that you can do. So remember, diet's critical. Little exercise is really important. I'm going to give you a food that you could be eating that will help, that will reduce inflammation dramatically. It actually will bring down your coronary C-reactive protein. It brings down other liver enzymes and so forth. What are we talking about? I'm talking about cherries. And this is cherry season, but make sure you get organic cherries. But cherries do a lot of different things. They'll decrease the inflammation, which is something that we want to do in this topic, right? And it increases recovery from all kinds of things. And it improves your sleep. How about that? How about that? If you could sleep better by eating cherries, I don't know about you, but I'd have about 3 or 4 of them a day, maybe a little bit more, during season. Make sure it's season time, right? This time of the year. And, if that helps that, and it helps weight management, which it does, by the way, and it increases other good things. But here's the piece while I'm talking about with cherries. I kind of, walked you into this trap. What it does, it boosts the availability and transportation of ascorbic acid, which is vitamin C, which is necessary to produce collagen. And it also helps protect against sun damage. So if that'll help that, and also reduce skin pigmentation, all those ugly black spots that we get sometimes as we get older, it helps. So I'm going to give you a little clue like that when you come on the 16th and you join us. Your doc says you got gout, right? Well, gout only happens in my big toe. No, gout can happen in your spine as well, and it can cause, a lot more inflammation. But the cherries, particularly the black oxheart cherries, will decrease the uric acid formation in your system. Isn't that cool? So if that's the case, go out and get some organic cherries and start picking on them a little bit, and get rid of the junk in your diet. The sugars, the sodas, the coffee, the black teas, the fast foods, the fried foods, the alcohol, the gluten, the additives, all the garbage, if you will, and get your health back. Start doing little things that make a huge difference in how your body functions. And maybe now you got huge lifestyle change that allows you to do the things that you thought you couldn't do anymore. I don't know about you, but I keep trying to tweak it. All these things called biohacks. Well, you can do your own biohacks without adding garbage to your system. We're coming up very close to the end of the program, and I want to encourage you to do a couple things. One, make sure you join me in the live stream. Go to drtomroselle.com, but follow me on social media and all of them that you have, and then we will send you information ongoingly. And anytime you go to drtomroselle.com, the live stream and the radio programs are there. And we're here every Sunday for you on WMAL 105.9, trying to give you as much information, but particularly encouragement to do what you need to do. I'm here for one reason. I love you all.
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Oh My Aching Back on Wednesday, July 16th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.